Behavioral healthcare programs aim to provide clients with the support they need to address mental health and substance use challenges, promote well-being, and achieve sustainable recovery. Central to the effectiveness of these programs is a clear understanding of client rights and responsibilities. This foundational framework not only ensures ethical treatment and mutual respect, but also empowers clients to actively participate in their care. This discussion explores client rights and responsibilities in behavioral health care programs, emphasizing their importance, key components, and how they influence the therapeutic alliance and outcomes. Client rights in behavioral health care are designed to protect individuals from harm, discrimination, and negligence while fostering a supportive and empowering environment for recovery. These rights are often rooted in legal, ethical, and professional standards and apply universally across behavioral health care settings. What exactly are the rights that clients have in behavioral health care settings? 1. The right to dignity and respect. Clients in behavioral health care programs have the fundamental right to be treated with dignity, respect, and non-judgmental care, regardless of their background, condition, or circumstances. This includes recognition of cultural, racial, and gender identities, respect for religious or spiritual beliefs, sensitivity to socioeconomic challenges and personal experiences. 2. The right to confidentiality. Confidentiality is a cornerstone of behavioral health care. Clients have the right to have their personal information protected under laws like the Health Insurance Portability and Accountability Act HIPAA in the United States. Be informed of the limits of confidentiality, such as situations involving harm to self or others. Decide who has access to their information, barring mandatory reporting obligations. 3. The right to informed consent. Clients must have access to comprehensive information about their treatment to make informed decisions. Informed consent involves clear explanations of treatment options, including potential benefits and risks, an understanding of the program's policies and procedures, the ability to refuse or withdraw from services without coercion. 4. The right to access quality care. Every client is entitled to high-quality care that is evidence-based and aligned with best practices, delivered by qualified and competent professionals, tailored to their unique needs and goals. 5. The right to participate in treatment planning. Clients have the right to be active collaborators in developing their treatment plans. This includes setting personal recovery goals, choosing from a range of therapeutic options, receiving regular updates and adjustments to their care plans. 6. The right to freedom from discrimination and abuse. Behavioral health care programs must provide a safe environment free from discrimination based on race, gender, sexual orientation, or disability, physical, emotional, or sexual abuse, retaliation for expressing concerns or grievances. While clients have clearly defined rights, they also bear responsibilities that contribute to the effectiveness of their treatment and the overall success of the program. These responsibilities help maintain a collaborative and respectful therapeutic environment. What are the responsibilities of clients in behavioral health care settings? Clients have the following responsibilities. 1. The responsibility to participate actively. Clients are encouraged to engage in sessions and follow through on agreed upon goals, provide honest and accurate information about their experiences and symptoms, take an active role in their recovery process. 2. The responsibility to respect others. Clients must treat staff and other clients with respect and courtesy, refrain from disruptive or harmful behaviors, honor the diversity and privacy of others in the program. 3. The responsibility to comply with program policies. Adhering to the rules and guidelines of the program is crucial. This includes attending scheduled sessions and activities, abstaining from substances if required by the program, following safety protocols, and reporting any concerns. 4. The responsibility to communicate concerns. Clients should feel empowered to express dissatisfaction or grievances in a constructive manner, Seek clarification when policies or treatment plans are unclear. Advocate for their needs while respecting program limitations. 5. The responsibility to maintain confidentiality. Just as clients' information is protected, they have a responsibility to respect the privacy of other participants. Avoid sharing sensitive information about peers outside the program. The interplay between client rights and responsibilities is pivotal in fostering trust and collaboration within behavioral healthcare programs. A balanced approach ensures that both clients and providers feel valued and supported. We build trust through transparency and open communication about rights and responsibilities at the outset of treatment establishes trust. For example, orientation sessions can provide clients with detailed information about their rights and program expectations. Written agreements outlining mutual responsibilities can prevent misunderstandings. How do we address conflicts? When conflicts arise, addressing them promptly and respectfully is critical. Behavioral healthcare programs can use mediation or conflict resolution techniques, provide clients with clear grievance procedures, offer staff training on de-escalation and empathetic communication. Adhering to ethical and legal standards is essential in upholding client rights and responsibilities. These considerations include 1. Legal protections. Laws and regulations play a key role in defining and enforcing client rights, such as HIPAA for privacy and confidentiality, the Americans with Disabilities Act ADA for non-discrimination, state-specific licensing and accreditation standards. 2. Ethical guidelines. Behavioral health professionals are guided by ethical codes established by organizations like the American Psychological Association APAP, the National Association of Social Workers NASWA, the American Counseling Association ACAD. These codes emphasize principles like autonomy, beneficence, and justice. 3. Informed advocacy. Behavioral healthcare programs have a duty to advocate for systemic changes to address gaps in client rights, empower clients to understand and assert their rights, monitor compliance with ethical and legal standards through audits and feedback mechanisms. While client rights and responsibilities are well defined, practical challenges can arise in implementing them effectively. Challenges. 1. Stigma and discrimination. Clients often face societal stigma that may impact their willingness to seek care or assert their rights. 2. Resource constraints. Limited funding and staffing can affect the quality of care and the ability to uphold client rights. 3. Cultural barriers. Language differences, cultural misunderstandings, and lack of cultural competence among providers can hinder communication and trust. Opportunities. 1. Education and awareness. Providing clients with educational resources about their rights and responsibilities can enhance their engagement and confidence. 2. Technology integration. Telehealth and digital platforms can improve access to care and streamline communication about rights and responsibilities. 3. Policy advocacy. Advocating for policy changes and increased funding can address systemic barriers and improve program outcomes. Client rights and responsibilities form the ethical and operational backbone of behavioral healthcare programs. By upholding these principles, providers create an environment where clients feel respected, safe, and empowered to pursue their recovery journey. At the same time, fostering a culture of mutual responsibility ensures that programs can operate effectively, maintain integrity, and achieve lasting positive outcomes for individuals and communities. As the field of behavioral health continues to evolve, ongoing dialogue and collaboration among stakeholders will be essential to address emerging challenges and seize opportunities for growth. Together, clients and providers can build a foundation of trust, respect, and shared accountability that transforms lives and strengthens communities.
To Clients' Rights Refresher Training. In this training, we will review the rights of the clients. Clients have the right to receive humane treatment with respect and consideration. Clients have the right to privacy and confidentiality when seeking or receiving care except for life-threatening situations and conditions. Clients have the right to confidentiality in regards to their medical records and files. All clients have the right to receive accurate information concerning diagnosis, treatment, risk, and prognosis of illness or health condition. All clients have the right to ask about reasonable alternatives to care at BCBH or any outside facility. Clients have the right to a second professional opinion regarding diagnosis or treatment. Clients have the right to participate actively in decision-making regarding one's healthcare and treatment options. Clients have the right to access information regarding the scope and availability of their services. Clients have the right to be informed about any legal reporting requirements regarding any aspect of screening or treatment. Clients have the right to ask and receive their medical record upon request with written authorization. Clients have the right at any time to file a complaint with the director of BCBH regarding all concerns related to their privacy, confidentiality, security, or medical records. At any time, clients have the right to review their medical record and amend as needed. Clients have the right to revoke their authorization for release of information except to the extent when action has already been taken. Clients have a right to a copy of any fees and charges related to their visit. Clients have a responsibility to provide complete information about one's illness or problems and able to allow proper evaluation for treatment. Ask questions to ensure the understanding of condition or problem. Show respect to the intervention team. Reschedule and cancel appointments so another client can have that session. Pay bills or file health claims in a timely manner. Provide requests for permission to release health records in writing. And finally, inform their practitioner or practitioning team if the condition worsens or if there's a change in medication.